Well, a very good afternoon. We are now outside Dora Nginza Hospital where members of NEHAWU and now NOPSA, who have also joined the protest, are saying they're going to continue their strike action until their demands are met. You'll realize or understand that this protest started on Monday when NEHAWU workers are saying that they want an increase of 10% in their salary, they want a 2.5 housing subsidy, and they also want improved resources within the hospitals. This morning we got to speak to the chairperson of NEPSO, who have now joined the strike, Mrs. Fanel, and she was just saying that if one were to take a step inside these hospitals, you understand exactly why they are making sure they're not going to stop the strike. She was saying that the long hours the nurses have to work without any rest, the vacancies of posts that haven't been filled, and also obviously post-COVID where promises were made that they're going to increase their salaries, but to date nothing has been made. She also did say that she feels like government has failed because of the past 3 years they have been begging for a 10% increase, and if anything they've just had a 3 or even 1% increase in some stages. We also got to speak to the regional chairperson of NEHAWU, Mrs. Gqeberha, who was just saying that the state of hospitals in the Eastern Cape is really appalling, saying that if you just walk inside this specific hospital, you'll be welcomed by maternity ward that's overcrowded, where there are people that have to clean a ward single-handedly, where there's a raunching smell within the hospitals, the sheets are dirty, the staff are overworked, vacancies have not been filled. So she was asking, do you then blame workers if they protest? Because it's easy to say that their strike action is over the top, but if you step inside the hospital and just for 1 second be in the shoes of healthcare workers, you realize that the plight of healthcare workers for a long time has not been listened to. Also saying that she feels that the government has failed and continues to fail such a critical resources in our society. She did emphasize that obviously they have bowed down to the interdict. If anything, they are allowing people to access the health facilities. Also saying that as NEHAWU, they did not at all close hospitals, they didn't at all prevent people from accessing facilities, but also saying they're going to make sure that the residents here have easy access to facilities and get the medication and use the hospitals, but also just stressing that the issue of vacancies must also be dealt with, because it cannot be within a hospital like this, staff is a few number of staff in critical vacancies that are not being filled, and that is causing many of the staff members to be overworked. They did say they're going to meet as a regional strike to try to find out are they going to continue the protest or not, but saying that currently as things stands, because the demands have not been yet, this warrants for the protest to continue. But for now, let's go back to the studio.